The coronavirus pandemic means hospitals can't have visitors, and now families are being forced to say goodbye in the parking lot and rely on technology to stay connected with their loved ones. Hospitals and the chaplains want these families to know your loved one is not alone.
Everybody's doing what they can to make a unbearable situation bearable.
Gone are the days of sitting alongside a sick loved one in the hospital. COVID-19 has robbed us of that.
It created a dynamic that no one was prepared for, and that dynamic was the separation and the distance.
Mario Valdez is one of thousands of chaplains across the country right now working in healthcare facilities to ensure patients, family members, and hospital staff are spiritually and emotionally supported.
Really what we would do in person, we're doing by phone, and surprisingly, it has been a really impactful way in which we can still connect with patients and their families. They're scared, they're very anxious, and they're fearful, and so it's important that we help address that and be present through that and journey with them through that.
While nothing can replace the human touch, more important is the personal touch.
We all know the value of having a support network and how much strength that people find in that. Sometimes it's just being present. It just brings a lot of healing to people.
Sometimes that means Chaplain Joe Phipps masks up to visit his non-COVID patients from a safe distance. Other times it means making another call to check in on one of those fighting to survive this pandemic.
As hard as it is, it's giving patients a lot of time to sit by themselves and to evaluate their lives. And for them to see how they want life to look moving forward, I think has created an atmosphere for more healing.
Chaplains are available 24/7. They're sort of the unsung heroes in all of this. And while healthcare workers are also going well above and beyond, spending extra time with their patients who are really missing their families right now, their time is very limited. So it really has to be a team approach, working together to treat the physical, emotional well-being so patients aren't lonely right now.
Yeah, and Nicole, the chaplains really are calling on those healthcare workers.
Yeah, absolutely. They're lending that ear, doing what they can to help support them right now, checking in on the caregivers as much as the people they're caring for. And we all saw how needed that is after that New York doctor committed suicide. And they're dealing with some of the hardest hit areas right there. It's certainly taking a toll on everyone right now.